do a little bit about mock code, okay? So when you come in for mock code, you're going to be here in simulation again with me. And I want you to use the monitor, okay? So when you use the monitor, again, you're going to be using the oximeter. We don't have cardiac leads, but you remember how to place the patient on the monitor. You just touch where it says touch. Go ahead and start it. You are also, you're just going to touch where it says touch. Then I'm going to take a blood pressure using the monitor, so I'm going to hit start. I'm going to start talking to my patient, do my assessment. When I notice that something's wrong, I got lots of things that I can do, right? I can call the doctor. I can get some help in here. I can continue with my assessment. Okay? Remember that suction is up here. There's gloves. There's an ambu bag. There's oxygen. Okay? Let's take a look at our crash cart. Crash cart's going to be located right in here, so you don't have to be nervous and feel like you're going to have to run out into the other lab for that. So the first drawer has syringes in it, alcohol, 2x2s, flushes, needles. Okay? The second drawer has defibrillator supplies. There's also a portable defibrillator right up there. Medications are located right here. These are emergency medications, just like you would use emergency medications. IV equipment, primary and secondary tubing, as well as IV bags. Respiratory equipment, we have nasal cannula, mask, endotracheal tubes, veni mask, a trach holder, another trach holder, a trumpet, an ET tube holder, all sorts of trachs. Fun stuff right there. And there'll also be a laryngoscope in here too. And then the bottom, there's a CVC kit in here, another ambu bag. This is an OG. And if you gotta have this put down, OG. Okay? This also has oxygen, and there's a backboard right there, okay? So, do you know how to run a code? Maybe. Are you going to be in charge of running the code? No. Somebody else will be in charge of the code. Who will be in charge of running the code? Either the doctor, nurse practitioner, PA, or nurse and supervisor. Okay? Do you know how to do CPR? You should. Every one of you is CPR certified. Do you know how to assist respirations? You definitely should. You should know how to use the ambu bag. You should know how to operate a flow meter. Do you know how to assess a patient? I hope so. Do you know how to administer medications? You should at this point. Do you know how to use PPE? Definitely. Do you know how to document a code? In a situation where everything is running at 100 miles an hour, a lot of times what people will use is a paper towel. It's my favorite method of documentation personally. But then I go back and I make it more formal. So I'm going to show you the form that we use and that we're going to use for our code. Okay? And that'll somehow start to get your level of anxiety down. If you're not coming to code or to simulation, if you're not coming to run a mock code this week, you are coming to complete a quiz, okay? So I want you to show up anyway. If you're coming for mock code, show up in your uniform. Yes, in your uniform, because I'm wearing my uniform. You should be wearing your uniform. And then if you're not running a code, you're going to take a quiz next door in 201. So bring your laptop, okay?
Okay, so let's look at the documentation sheet, okay? On the first, you're going to see that the patient's name, date of birth, approximate age. If this patient comes to the emergency department and it's a John Doe, then all you have is John Doe. You don't have age, you don't have date of birth, you don't have any of that. Then we need to know, historian, who's telling us the story, the patient, the paramedics, the family, or the nurse. Now, if this patient that we have from Mock Code is already in bed, then this really doesn't apply to us, and that's perfectly okay. What we do need to know is if there is an arrest, what time it was, what time CPR was started, and what happened. Was it a respiratory, a cardiac, or something else happened? When you place the patient on the monitor, or the patient was on the monitor when it happened, what was the rhythm and what started all this? You're then going to know what time the doctor came, and because usually this is the emergency department physician or hospitalist, and then who the primary care doctor is and have they been informed. This usually gets filled out at the end of the code after everybody's been there and filed through, and it has you know, who the doctor, respiratory, nursing supervisor, the other nurses. This is important too. This is for the recorder. Whoever's filling this piece of paper out has to put down the time on whatever watch they're using and the time on the defibrillator, because sometimes they're off by a couple minutes, and that's really important, especially if the code doesn't go well, or it does go well, or something happens, if there's a question of how long did it take in between this and that. If there's a discrepancy and the recorder is using two different methods to tell time, the monitor and the clock on the wall, then that is going to make a big difference in what time things actually occurred. So whatever the person who records uses to record time needs to be the same thing. So if they use a wall clock, then they need to use a wall clock. If they use their watch, then they need to use their watch. Okay. So moving down, we see that there's IV, time, gauge, site, and initials. This is if you have to start it. If it's already started, you can just put IV present. Then we're looking at respiratory management. Is there an airway? Were they intubated? Was placement confirmed? If it was confirmed, we need to confirmed by CO2 and X-ray. We also need to know what size the tube was, what time it was intubated, what the number is at the lip line, and make sure that it was secured with a ET tube holder. Okay. Now we see that our ACLS meds are listed first and what time you gave them. Time, rhythm, time, rhythm, time, rhythm, initials. Okay? The medication nurse is giving them, but the recorder is recording what time and what the rhythm is. Okay? So this epinephrine can be given 3 times. If you need to give it more than 3 times, we would just come down here and write it. You also need to differentiate if you're giving an IV, endotracheal tube, or IO. For defibrillating biphasic, which we're going to use, what time, what the rhythm was, how many joules you used, and what the rhythm was afterwards. Then down here is some vital signs. You can go ahead and put those in. Then what time the labs were drawn. Was there an Accu-Check? Was there ABGs? Did a Foley get put in? NGOT? Was there a chest x-ray? And any other kind of notes you'd like to write, you can put down here. Okay? And I'm going to make this into a PDF file, And you can have it, but you will have it for mock code. And I would ask that you guys use it so that you become familiar with it, and it's not so foreign.